All right, everyone. We're fortunate to have Dr. Ryan here with us. He's just spent 45, 50 intense minutes discussing COVID with the County Board of Health, and but we're going to try and press him a little bit further. Thanks again for joining us, Dr. Ryan. Oh, boy.
There we go.
That's my bad. I apologize, but here you are.
No worries. Thanks for having me.
Okay, so I wanted to start out with a broad look at the general trend throughout the country and in Colorado as well. We had that horrible, gigantic third wave after the holidays and into the new year. And then we came dramatically down to a high plateau, is higher than even last summer, but nevertheless a plateau for 6 weeks or so. And now, disturbingly, we're trending upwards. What are your thoughts about, oh my gosh, maybe a fourth wave?
Unfortunately, Mark, you are correct. So, as we've been saying for the last several weeks, the plateau or the decline stopped, and we were at a plateau, and that plateau is much higher than was last summer and far higher than we would be comfortable with from a public health perspective, both in Colorado but also across the country. And over the last week, we've now seen that plateau take a turn for the worse, and it is now heading up in the wrong direction, both here in Colorado and across the country.
Well, I guess in part it has to be, here's the two things I see. You tell me what you think. One, I see that the B117 variant has really exploded. It's as much as 35% or more in cases in some places, and also people's weariness with lockdown and mask wearing. Those two things together have sort of contributed to this surge that we're seeing in cases. What do you think?
Oh, absolutely. People are letting their guard down, entire states, for that matter, Alabama, Texas, and just to name a few, as you know, have gotten rid of their mask mandate altogether. And what that does is it gives people a false sense of reality. It suggests to them that somehow the pandemic is over. The pandemic is not over. When you have in excess of 60,000 cases a day as the 7-day average over the last several months, that doesn't suggest the pandemic's over at all. In fact, it's sort of in a holding pattern. And so when states like Texas and Alabama and others remove their mask mandate, people don't do the right thing. They don't wear their masks. They stop wearing their masks. And they have a false sense that things are back to normal. And they start booking trips and go places and travel. Over the last several weeks in this country, we've seen record number of people traveling via air than we have over the last 12 months. So that suggests to me that the potential for spread is only exacerbated when you have now millions of people traveling around the country every single day. And you have now a variant that's far more transmissible than the previous ones. And so it just makes for a terrible, terrible storm. And that's what we're seeing now in spades. I mean, if you look at England a few months back, the B117 UK variant, all it took was 3 or 4 weeks for that country to go from a very low number to an excessively high number, just based on that one variant alone. So that's where we're at right now in this country. The next several weeks are going to really tell us what's going to happen. Obviously, it's a race against time and has been for the last several weeks, trying to get folks vaccinated. And we're now seeing some of the effects of that in the positive way, right? As I went over the numbers in our county alone, all of them, with one exception, are under the age of 60. And so we are doing our best to protect people, and we have so far, and the 60-plus-year-olds done a great job of getting them vaccinated. But now it's up to the 20s and 30s and 40s and 50-year-olds to continue to do the right thing wear your mask, socially distance. The pandemic is not over. Unfortunately, it's going to take us several more months to vaccinate everybody and get to that level of immunity that we need. That's further challenged by states like Texas, for instance, suggesting to people that somehow the pandemic is over. What that does is it tells people, I don't need a vaccine, right? Because the pandemic's over, I'm not at risk anymore. That could not be further from the truth. You do need a vaccine. All the more reason why you need a vaccine now is because some of these variants, they don't care that you've had COVID in the past. You can still get COVID with some of these variants, the B117 as an example. It's a different virus from the one that you may have had. So you can get COVID again. We now know that in spades across the entire country. So it's incumbent upon all of us, and I know I've said this so many times over the last many conversations that we've had. It's incumbent upon all of us to continue to wear our masks and socially distance until we can get folks properly vaccinated across the country.
Well, I'm sitting in the studio of KGO right now wearing my mask. I'm here by myself, but other people have been in the building within the last few days, and I'm not taking any chances, even though I've already been vaccinated. I just don't want to be the last guy to get COVID, right? So I want to focus for just a moment on this question of mask wearing, because I agree with you, of course, that the states that have lifted their mask mandates are foolishly and recklessly endangering the lives of their constituents, the governor and the politicians who are responsible for those actions. But I have heard talk out of Washington that maybe President Biden, he's at least considering a national mask mandate. What do you think of the chances of that happening, or even the success of such a mandate?
Well, I think a national mask mandate is necessary when you have states like Texas and Alabama and others who are removing their mask mandate. We are now seeing across the entire country case counts go up. And so the best way, as we have now known for many, many months, to slow the spread of the virus is to wear your mask, in addition to vaccinations. So the combination of those two is highly effective. And when you remove that mask mandate in a state, it suggests to everyone it's over. But a national mandate would go a long way. The challenge with it is in states like Texas, and I pick on Texas because it's our closest neighbor, that has gone away with the mandate. And we see a significant number of folks from Texas coming to Colorado to visit. So, but when you make a national mandate, states like Texas, it's incumbent upon them to enforce it, right? The Army isn't going to go out and enforce this. It's something that, and we've seen this across the country over the last many, many months, is that when the politicians and the leaders lead by example and lead by suggestion, that's what makes people wear the mask. It's not the threat of being arrested or given a ticket or enforced, right? It's when you look around and you see 90% of the people or 95% of the people around you wearing masks, you as a human are likely to put your mask on. But when 95% of the people around you aren't wearing a mask, they're unlikely to put your mask on in those scenarios. So a national mandate would be great, but I don't know how effective it would be when you have states across the country who have done away with their state mandate and basically given a green light by the leaders in those states, if you want to call them that, that it's okay not to wear your mask. And so, it would be great, but I'm not sure how effective it would be in states like Texas and Alabama and those sorts of places.
Well, I'm glad to hear that at least on the federal level we have a leadership that is listening to the science and considering what the best options might be. I want to change direction here a little bit, and I want to talk about the variants, but I'm going to ask you to bear with me, and I'd like to step back and just explain what it means to be a variant and what's the difference between variation and mutation, and are they the same thing?
Okay. Yeah, so viruses replicate, right? They create new ones. They create new ones of themselves constantly. So when the virus enters you, it's multiplying, right? It's mutating. It's growing and growing and growing, or it's duplicating. And when that process happens in the body, there are slight changes that happen to the actual virus in any one individual. And so most of those changes or mutations are benign. They don't really do anything, meaning they don't increase the transmissibility. They don't increase the potential mortality rate associated with it. They don't really do much of anything in terms of the virus and the impact on a human being. However, the longer you let that virus mutate, the higher the potential is for a mutation that is going to become problematic, meaning it's more transmissible and or more deadly. And this has been the argument and been the, I'm not sure what the opinion of all of the experts across the country, is that the longer we allow this level in this country, so 50,000, 60,000 cases a day, which is what we've basically had for the last several months, when you allow that high level, the potential for a significant mutation to be formed, the more likely we are to encounter one that's more transmissible and or more deadly. On that cabin situation. And if we do this long enough, the viruses are really, really smart. Changing environment. They're actually, and so the more likely mutation addressed by the vaccines that was you actually you're effective, and it's that no longer you have on hand. Moderna and Pfizer, looking at how it's seen it. Literally, as we receive the vaccine, let everybody know. We're going to need to get that vaccine is going to look slightly different potentially than the one that we've received already, the Pfizer, Moderna, and all the other ones, right? They're going to need to be adjusted, just like the flu vaccine is every year. It's slightly adjusted, given out to the population. And this is why public health, you've heard me say, we need to keep our numbers down and get our numbers down. And our masks and all, the lower our numbers, the lower the potential is for creating a mutation or a variant that is somehow not susceptible anymore to the vaccine. So the mutation, to answer your question, the mutation is like the actual changing, if you will, of the virus, right? It's mutating into something else. The variant is what that ends up being. So it mutates into something else, and that something else is now the variant. It's a different version of the original virus. That's as layman terms as I can put it in.
Well, that's quite an explanation, and I think that when I was listening to you, I'm thinking of the fact that every time a cell replicates or splits into two, there's a potential for for variation, and it's the same with a virus, right? And so then I start thinking, wait a minute, if someone is infected with a virus, they have millions, billions, maybe trillions of these viruses in their bodies, and so every one of those has a potential to become a variant that could make us more susceptible to the virus, or maybe perhaps more deadly, or both. And then you multiply that by the millions of people who have been infected, and it's like, oh my gosh, it's inevitable that we're going to have these variants, and the only way to stop it is to stop the spread of all of the virus.
Yeah, correct, exactly. So this is why we need to continue doing what we're doing: wear our masks, socially distance, get vaccinated as quickly as you can, but still act like you care and wear your mask and socially distance, because we haven't been able to vaccinate everyone over the last 2 months, right? We still have a significant number of the population who is unvaccinated. Furthermore, even once we vaccinate everyone who wants a vaccine over the age of 16, we still have 25% of the U.S. population who cannot get a vaccine because they're under 16 years of age. So we have a significant portion of our population who is still very susceptible to get COVID and spread COVID to others, right? They're completely unprotected and they're completely vulnerable. And so it's incumbent upon us to protect the next generation of our society, i.e. those under 16, by wearing our masks and socially distancing and doing all the things public health has been suggesting you do for the last many months. As I said on the BOCC call, you should be receiving your advice and suggestions and do what you are told by public health officials only, not politicians. Politicians are not in it for your public health perspective. They're in it from a political perspective. And so you need to ask yourself when you're listening to somebody, why are they telling me this and why are they saying that? I'm telling you this and I'm saying that because I'm a public health director, and it's incumbent upon me to help protect the health and well-being of the citizens of our county and our state and our country. And I will continue to do that for the foreseeable future until this virus is gone or at bay, until we can sort of go back to normal, if you will. But those days are not tomorrow and next week and next month. We're going to take time to get there. I understand the governor wants to get rid of the mask mandate, and other governors have already done that. That's, in my opinion, the biggest mistake we can make. We know it's the second most effective way of protecting us, and we're doing away with it when numbers across the state, across the country are going up significantly week by week. And we're not vaccinating folks as quick as we want to. So please do your part. Help us protect everyone else and protect the next generation who can't get vaccinated yet and likely won't get vaccinated until next year at the very earliest.
Well, I wanted to talk about that, but first let me just see if I have this right in my mind. I'm thinking about the portion of the population that is not going to be vaccinated anytime soon, if ever, and then I'm trying to think of that in the context of herd immunity, and it seems like there's three populations that can't or won't be vaccinated. It's the pediatric population under 16, and I know that there's some trials that are being conducted right now that takes time to ensure the safety and efficacy of the vaccines for that population. Then there is that group of people who, for maybe they're immunocompromised or for whatever reason, are unable to be vaccinated for medical reasons. And then there are those numbskulls who just think that the vaccine is a hoax or, whatever their imagined objection might be. But when you put those three groups together, it probably adds up to a number that does not allow for herd immunity. Am I wrong on that?
No, you're correct. So in order to reach herd immunity, and it varies by disease, et cetera, but the current estimates are in order to achieve herd immunity or community immunity in this country, we would need roughly 75 to 80% of the U.S. population to get vaccinated. Now, you're correct in your math. So if you take the under 16 years of age, the folks who can't get vaccinated for a whole host of reasons, and then the folks who choose not to get vaccinated for whatever reason or irrational thought they may have, that number is probably in excess of 30% of the U.S. population. The good news is 12 to 16-year-olds are likely to be vaccinated sometime later in the year, towards the end of the year, because those clinical trials are ongoing and are likely to be finishing up in the next several months, at which point you're aware of the process. They have to analyze the data and all that sort of stuff. So that gives us an additional segment of the population that we could potentially get vaccinated. But your assessment is correct. All the more reason why we need to continue to wear masks. We know conclusively we're not going to get to that 80% anytime soon. And so back to my point earlier, the longer we allow these numbers and case counts to continue at the elevated level they're at, the far more likely we are to reach the point where the vaccines no longer work because the virus is mutated such that it makes the vaccine irrelevant. And then we have to start over. I would prefer not to start over. I would prefer to take the progress we've made, which is significant, and continue building upon that progress. But again, it's going to take everyone doing their part, governors and politicians and your average citizen, and doing their part by wearing a mask and socially distancing and looking out for one another. It's one thing the pandemic has taught us is that it's not about an individual. It's about all of us collectively. People in this county, people in this state, people in this country, and more importantly, people across the entire world. We may address it in our country, but if the pandemic is still raging across the world because they don't have sufficient vaccines, for instance, the scenario is the same, right, that we've been talking about. The virus will mutate over somewhere else. As we have seen, we have a Brazilian variant, and a UK variant, and a South African variant. That is going to continue unless we address the pandemic from a broad worldwide perspective. And only then, when we get it under control, will it actually be under control. We are not an island, and we are not immune to what happens in the rest of the world. And so the sooner we realize and recognize that, and I'm pretty sure the Biden administration does, and do our part to help share the vaccines that we do create and do have. If people here aren't going to take them, we need to give them to somebody else who will. And there are many, many, many willing recipients around the world who don't have the privileged access that we have in this country. And so hopefully we can get as many people vaccinated worldwide as we possibly can, as quickly as we can.
Oh, I couldn't agree more. Let's until we have that vaccine out in the population worldwide, the variants are just going to keep on coming. They're just inevitable. The science doesn't leave any room for doubt on that one. I was very encouraged, though, to hear you say that 12 to 16-year-olds will probably be eligible for vaccination sometime before the end of the year. That is such great news. I did want to change to another topic that is rarely discussed. I hear you speak weekly about the number of people who are hospitalized, and I think of the conversations that I hear in that reluctant population, the population that wants to congregate, the population that is reluctant to wear a mask, the population that is maybe considering not becoming vaccinated. The rationale seems to be, well, if I have flu-like symptoms for a few days, big deal. And I'm probably not going to die because the death rate is so low now. But I think about those all those people that have been hospitalized and the the torturous regime that they go through in the hospital for weeks on end. I don't know why anybody would take a chance on that happening, especially since the hospitalization rate is still very high.
It is, Mark, and to your point, these new variants seem to be resulting in a lot more 20, 30, 40, and 50-year-olds in the hospital. As I stated earlier, we've done a great job across the state and the country of getting our 60-plus folks vaccinated, and we're seeing those numbers drop significantly in terms of hospitalization. But what's happening now is those 20, 30, 40, and 50-year-olds who aren't yet vaccinated are taking the 60-plus-year-olds' place in the hospital. And my wife, who's a professor at CSU and doing an ongoing clinical trial in COVID patients, one of her study partners is the head of the trauma unit at MCR, and she spoke to her and an infectious disease physician there yesterday. It was very troubling to have healthy 30 and 40-year-olds now in the ICU, and the medicines they were using to treat 70, 80, 90-year-olds aren't working for these 30 and 40-year-olds. And it's baffling to them why that is, and they're struggling to figure out how to help these folks who are now in their 30s and 40s and otherwise healthy, who thought, I might have flu-like symptoms for a couple days and it'll be over. That isn't the case. When these mutations come out and the variants are out and now in the community, they can often result, as I said, in far more transmissible, far more deadly, and now we're seeing in spades. It's not necessarily more deadly, but it's far more likely to end you up in the hospital, which is not where you want to be. And so these folks are not invincible. They're just as susceptible as we're now finding out as the 60s and 70s and 80-year-olds were from the original virus. And these viruses, as I said, they're very, very smart, and they're very good at doing what they do and mutating and changing based on their host, not only you as an individual, but as a broader community. They're incredibly smart at doing that sort of thing. And that's how they do the damage that they've done, right? I stated this earlier. This is a point of clarification. I was told so many times in the beginning of this isn't any more deadly than the flu, Dr. Ryan. I think you're being a little bit overly cautious and blah, blah, blah. More people have died in the United States of America this last 12 months, than did from the flu globally from 2018 and 19. So the notion that somehow this is just like the flu and not any more deadly is absolute nonsense. We have 550,000 Americans who are dead because this wasn't taken seriously. And so it's a matter of, when are we going to take it serious enough? What does it take? 1 million Americans dead? 2 million Americans dead? To start taking things seriously?
I don't know. There's no answer to that question, and it's grim to even imagine the prospects. I wanted to say that the mask wearing, of course, is so important in conjunction with the vaccines. Hopefully, the Biden administration is going to make a decision for a national mandate. From my perspective, I think that would be exactly the right thing to do. You've given us hope that within the year we'll be able to vaccinate 12 to 16-year-olds. That's all great news. There is that stubborn group of vaccine reluctant population. And I just wonder if you have any thoughts on strategies that might change the mind of some of those folks.
Mark, the thing that we found most effective is to be open and honest and present the facts to them. A good portion of those folks are just hesitant. They're not anti-vaxxers. They're just hesitant because they perceive this as a new vaccine and don't really have a sense that it's safe. It's completely safe. Experts around the world, in Europe and everywhere, have looked at these vaccines under the microscope, so to speak, and found them to be incredibly safe. and more importantly, they found them to be very efficacious, meaning they have a very high rate of protecting you against the virus. And so what we found is relaying these facts and realities to folks. Tens of millions of Americans have now been vaccinated. And you've heard anecdotally of a case here or a case there of something happening. And unfortunately, those cases are highlighted by people who want you to not get vaccinated and say, look, see, I told you that person died 4 days after getting the vaccine. The problem with those anecdotes is they're not based in reality. That individual's death had next to nothing to do with the vaccine. It had everything to do with the fact they had a heart attack because they're grossly overweight, diabetic, and hypertensive. It didn't have anything to do with the vaccine. But they're using these cases to highlight the potential danger that isn't based in reality. So we find that when talking to people who have subsequently circled back and gotten vaccinated, right, and just present to them the facts that these are safe. They've been given to tens of millions of people around the world, and the data is continually collected on those folks and what happens. And they're effective at what they do in terms of protecting you from the virus. So we find that honesty and just presenting the facts is a good way to start. There are some people, it doesn't matter what you tell them. When you live on Planet Fox and your reality is somewhere else, it doesn't really matter what truth or fact they present to you. You're going to discard it anyway. Those folks, I don't know that we're going to make inroads with. It's very unfortunate. But those folks who are just hesitant and maybe don't really understand and or have been getting misinformation from an inappropriate source, and just educating them. It's part of the reason and rationale behind our town hall that we have on a monthly basis, and why I do these radio interviews, and why I'm on the Board of County Commissioners call every week, to really try to get out there as much factual information as I possibly can and let people make that decision. I and my entire family, well, those who are qualified and eligible, have been vaccinated because I know it's safe, and it's safe enough that I'm willing to now sign my 17-year-old daughter up to get vaccinated. I have absolutely no hesitation in the world. Why? Because I understand the facts. I've seen the data. I've seen the analysis. And furthermore, I trust people like, for instance, Dr. Fauci. He's been a career professional at the highest level possible, and I trust his analysis and his comments about the vaccines and the rollout and all those sorts of things. I do not trust politicians from that perspective on what they may tell me. So finding those experts that you know are experts and don't have an ulterior motive and listening to them and what they're saying and what they're relaying to, I think, is a critical component to it.
That's great advice, Dr. Ryan, and I couldn't agree with you more. I mean, we love here in Clear Creek County. We love listening to you. We consider you a guiding light when it comes to advice regarding COVID. And I also try to follow Dr. Fauci, and I go on the CDC website very frequently. As a matter of fact, I've got it pulled up right now on here at the station, and I'd just like to share with our listeners a piece of factual information. Since the vaccines have been rolled out on December 14th, there have been 2,216 reports of death among people who received COVID-19 vaccine. Wait a minute. That's reports of death. And by the way, that is 0.001.8%. It's a tiny fraction of the people. And each one of those cases has been reviewed by a panel of medical experts. And not one of those cases can be attributed directly to a vaccination. Not one. In the meantime, hundreds of thousands of Americans have died of COVID vaccine. It's just there is no argument that on the other side of that statistical argument.
Right. I couldn't agree more, Mark. And as I said earlier, these folks are being followed, and their cases are investigated and looked into. And as you stated, not one of them is related to the vaccine. They're normal causes of death: heart attacks, strokes, diabetes, hypertension, et cetera. No connection whatsoever to the vaccine. This sort of level of scrutiny goes on and will continue on with the further development of the vaccine as well. So I think it speaks volumes to the safety of this vaccine. Both the Pfizer and the Janssen and the Moderna and others, they all go through this incredible level of scrutiny. It's required by law. And those experts, like Dr. Fauci, are there looking at that data and following this on a daily basis. If at any point they saw something that was significant or meaningful, they would draw our attention to that and make it known. They're not going to sort of sweep it under the rug. This is why this data, as you just relayed, is on the CDC website for all to see. Trying to get the facts out there and trying to overcome those anecdotal nonsense where, they say, these 2,200 people died after getting a vaccine. Chronologically, yes, that's correct, but there's no association whatsoever between their deaths and the vaccine itself. So, but to your point, thousands of people are dying on a daily basis from COVID, and so it's incumbent upon us to get as many people vaccinated as quickly as possible to help us get out of this nightmare that we've been in over the last year.
Well, Dr. Ryan, I have just one last subject that I'd like to cover with you, and I guess I take a kind of a hardline position on people who don't want to become vaccinated, and I'd like to couple that with the discussions I've seen recently regarding vaccine passports. My view is that the point is going to come sometime in the not-too-distant future when there are going to be more vaccines available than people willing to be vaccinated. And I know that that's counterintuitive to the frustrations that you have regarding vaccine availability here in Clear Creek County, and I share your frustration around that. But I think that day is coming where there's just going to be this population that's hard to reach or not willing to become vaccinated. And my feeling is that an app can be developed, or you could put a picture on your phone of your CDC documentation that you've been vaccinated. And if you want to go out in public, you want to go to a concert, you want to go to a restaurant, you want to go to a bar, any place except some, let's say your doctor's office or the pharmacy or the grocery store, any place other than that, you either show your passport or you don't go. I just like to have your thoughts on that. I see that happening, to your point. I see, particularly if you want to travel outside the United States, countries will be very discerning in terms of who they allow in. And proof of vaccination is going to be high, probably on their list of that. So I find that to be highly likely here in the very near future, probably in the next several months, that if you want to go to places like Europe, for instance, you're going to need to prove that you actually have not only the vaccine, but potentially a negative test within days of your travel. So as far as that going on in this country, I find that less likely. To your point of, in order to go into this place or that place, you're going to need to be vaccinated. I really don't see that happening unless things get significantly out of control, and it's certainly within the realm of possibility. I, as a business owner, I would probably be discerning in terms of who I let, the clientele I let in. If the economics are driving me as a business owner, I'm going to let in everyone who's been vaccinated and be open 100%, rather than try to let in somebody who hasn't been vaccinated, who doesn't seem to care, and then have to deal with the outcome because they are COVID positive or whatever, and go from there. So from an international perspective, I see it happening. From a domestic perspective, probably far less so. All right, Dr. Ryan, between the county commissioners and KGOT Radio, you've been talking for an hour and a half, and you probably have had enough. I'll give you an opportunity to add any last comments that you'd like, and then I'll cut you free.
Thanks, Mark. Appreciate that. So my only comments would be, if you're 16 years of age or older, please get vaccinated as quickly as you possibly can. We don't have Pfizer vaccine in our county, so if you are 16 or 17, you'll need to go elsewhere to get that vaccine, but I know Summit and Jefferson do have vaccines for you. But for other folks, please get on our list. Please get pre-registered as quick as you can. It will give us a sense of how many vaccines we should order in any given week, and hopefully in the week and two coming up, we will see a significant opportunity in terms of the vaccines we can receive. In the meantime, keep wearing your mask. Keep socially distancing. Keep doing what you've been doing. Don't go to social gatherings unless all of you are vaccinated at the gathering. And there's ways, if you have a small party, there's ways to do that. So it's going to take continued effort for the next several months, but I think we can make it through this. This next several weeks is going to be really telling in terms of where this country is heading. Is it going to be another significant spike? Or are we going to get it under control with vaccines and with mask wearing and those sorts of things? So please be patient and please do the right thing for your neighbors and for yourself. Thank you.
Dr. Ryan, thanks a million for your time and for all of your efforts here within our community. You've been such a great asset to us, and you're the firewall against the COVID here in Clear Creek County. Thank you so much.
Thanks, Mark. I appreciate that. Everyone have a great day and be safe. Be well.
Bye. All right, everyone. Dr. Timothy Ryan, your and my Director of Public Health here in Clear Creek County. Always a fountain of information and great advice. We'll look forward to hearing from him again sometime real soon. And in the meantime, keep yourself safe, keep that mask on, and don't be the last person to get COVID in Clear Creek County. Please, let's just all make it to the end. We're so close. Take care. See you next week. Here's some recorded music for your listening enjoyment.